Looking into the occipital bone, that's going to be on the posterior side of the skull. So we've looked at in previous videos the frontal bone and the parietal bone so far. Now we're going to focus on the occipital bone. So we need to rotate this so we're having a posterior view. Now this is going to be a posterior view. You can see here is the occipital bone. Each of these are going to be parietal bones. Remember, the suture that separates the occipital bone from the two parietal bones is going to be the lambdoidal suture. But now to go through all the landmarks, as you can see, we get down here underneath or inferior, we need to switch back to the regular skull. Now here we have the normal skull from an inferior view. What you'll notice is this is the anterior side up front. You can see that's the nose. This is the occipital bone back here. So this is the posterior side down here at the bottom. For landmarks, the first thing we'll see is the foramen magnum. Now foramen, remember, means hole. This large opening right here is the foramen magnum. Think about the foramen magnum, that's where the spinal cord is going to meet with the brainstem. Now on each side, each lateral side of the foramen magnum are these smooth patches right here and right here. Those smooth patches are occipital condyles. Occipital, because the bone, condyle is a raised smooth surface. These two occipital condyles are what will articulate with the first cervical vertebrae. Now articulate means come into contact, form joints. Occipital condyles. From there we have the external occipital protuberance. The external occipital protuberance is this raised portion right here on the posterior side. So this is the external occipital protuberance. Now it helps if I end up picking this up a little bit, so let's reorientate. All right, now that we've reorientated, we're looking at the posterior surface. This is the occipital bone. You can see this part right down here. This is going to be where you have the foramen magnum, occipital condyles each side. The external occipital protuberance is this bump right here. Now on each side of the external occipital protuberance is going to be the superior nuchal line. Now remember, orientation-wise, this up top here is superior, this down here is inferior. You can see how there's a ridge right along here. This ridge, that is the superior nuchal line. Now, just below that is the inferior nuchal line. That inferior nuchal line goes right along here. So inferior meaning lower. So find the external occipital protuberance, this bump right in the back of your skull. You can actually feel that if you feel the back of your skull. Superior nuchal line, and then inferior nuchal line is below those two, inferior nuchal line. And then we have the hypoglossal canal. Hypoglossal canal, we need to orientate back, looking at the foramen magnum. Each one of these is going to be your occipital condyle. Now the hypoglossal canal is just superior to the occipital condyles. Now keep in mind orientation here. We're looking at the underside of the skull. This is the bottom of the skull. That means superior is going down towards the tabletop. So when we look at this, there is a hole just on the side here. I'm going to try to reorientate this so you can see it. Now that we've reorientated, I'm going to twist it a little bit. You can see foramen magnum, occipital condyle right here. As I rotate just a little bit, you're going to start to see this opening right there. I'm putting the probe into it. That opening, so occipital condyle, just superior, going towards the top of the skull. That is going to be your hypoglossal canal. So again, I'll orientate. This is purely inferior. We're in the bottom of the skull. occipital condyle, foramen magnum. But if I'm rotating this a little bit, you see some light coming through right here. That is just above or superior to the occipital condyle. Where that light comes through, that is the hypoglossal canal. So looking at the occipital bone itself and the landmarks of the occipital bone.